Do you often feel like you can't catch your breath after working in a dusty barn or handling moldy hay? Or maybe you feel tired all the time and your chest feels tight, like a heavy blanket is sitting on it. These might not just be simple allergies. You could be dealing with something called hypersensitivity pneumonitis, also known as farmer's lung. It's a lung disease where your body overreacts to things you breathe in, especially tiny particles found in moldy crops, hay, or grain. Think of it like your immune system going into overdrive, thinking these tiny invaders are dangerous, even though they're just dust and mold. Over time, your lungs get inflamed and scarred, making it harder to breathe. It's common in farmers, but it can affect anyone working around damp, moldy organic materials. What causes farmer's lung? Imagine you're cleaning out an old damp shed filled with moldy hay. As you move the hay, you see small dust particles floating in the air. You're breathing them in without even knowing. These tiny particles contain mold from bacteria and fungi that grow in damp places, especially on wheat, barley, or hay. The real culprits are microbes like Saccharopolyspora rectivirgula, once called Micropolyspora fini. When your body detects these, your immune system reacts too strongly. In type 3 hypersensitivity, immune complexes like antigen-antibody clumps build up in your lungs and cause swelling. In type 4, specific immune cells, called T cells, attack the lung tissue directly. So it's not the mold itself that harms you, it's your body's exaggerated defense that causes the damage. How do you know if you might have farmer's lung? Let's play a quick quiz. Have you felt feverish, like you have the flu, a few hours after working around hay or grain? Do you cough a lot, feel short of breath, or hear a crackly sound when you breathe in, kind of like bubble wrap under your chest? If yes, and these symptoms keep coming back after exposure to dusty farm environments, it could be farmer's lung. At first, symptoms might go away when you leave the farm. But if you keep getting exposed, they become constant. You might feel very tired, lose weight, and even develop long-term lung damage like pulmonary fibrosis, where your lungs turn stiff and struggle to deliver oxygen. It's like your lungs are slowly turning from soft sponges into hard leather. How do doctors find out if it's farmer's lung? First, they'll ask, do your symptoms get worse after farm work? Then they'll listen to your lungs, check blood samples for antibodies, and might do a chest X-ray or CT scan. A scan might show tiny dots or hazy patches, like fog inside your lungs. They might also test your breathing capacity with a spirometer. You blow into a tube to see how much air your lungs can hold. In some cases, a lung biopsy is needed, removing a tiny bit of lung tissue to check for inflammation. Once diagnosed, treatment starts with one key step: stop the exposure. No more moldy dust. Doctors may also prescribe corticosteroids, pills that calm your overactive immune system, like turning down the volume on a loud alarm in your lungs. The earlier you catch it, the better your lungs can heal. Can you prevent farmer's lung? Absolutely, and this is super important. Think of it like wearing sunscreen to stop sunburn. First, reduce moldy dust. Store hay and grain dry and well ventilated. Use masks. A simple N95 respirator can block those tiny particles. Did you know a regular cloth mask won't help much? You need one rated for fine dust. Also, take breaks outside when working in dusty areas. Wet down moldy materials before handling them, just like how a little water stops dust from flying when cleaning your room. Farmers, talk to your team. Make safety a habit, not a one-time thought. Prevention is always better than fixing damage later. Scientists are now using advanced blood tests to spot specific antibodies earlier, like finding a warning sign before the storm hits. Researchers are also studying how genetics play a role. Not everyone exposed gets sick, so maybe some people's immune systems are more sensitive. New monitoring devices, like wearable air quality sensors, help farmers check dust levels in barns in real time. Imagine a smartwatch that buzzes when mold spore levels get too high. There's also work on vaccines or immune-modifying treatments to train the body not to overreact, though that's still in early stages. The goal: catch it sooner, prevent harm, and keep farmers healthy and working.